Now, let me discuss on the chapter Forensic Psychiatry. Look here, all of you are aware of a rule called McNaughton's Rule, the right or wrong test, the legal test. Okay, what McNaughton Rule says? It says that to establish defense on the ground of insanity, it must be clearly shown that at the time of committing the crime, the accused was laboring under such defect of reason from the disease of the mind as not to know the nature and the quality of the act he was doing, or if he did know this, that, he did not know that what he was doing was wrong. That is McNaughton's Rule. That means, if a mentally ill person commits a crime, and if a defense lawyer wants to prove in the court of law that he is suffering from mentally ill and he is not liable for his act, it should be clearly shown that at the time of committing the act, you were laboring under such defect of reason from the diseases of the mind. That means there should be some organic disease of the mind from which you must have lost the reasoning capacity. How much? That you should not know the nature of the act or quality of the act. Even if he knows the nature and quality of the act, he should not know what you were doing was right or wrong. That is McNaughton's Rule. Now, same thing has implemented under section 22 of Bharatiya Nyaya Samhita. So 22 of Bharatiya Nyaya Samhita has been derived from McNaughton's Rule. So here, look here, to establish a defense on the ground of insanity, it must be clearly shown that at the time of committing the act, the accused was labored in such different reasons from the disease of the mind. Also things, as I already mentioned, this is according to which law of insanity? McNaughton's Rule. Section 22 of BNS deals with act of person of unsoundness of mind. That means whether a person is criminally responsible or not if he is suffering from any mental illness. What it says is, nothing is an offense done by a person who at the time of doing it by reason of unsoundness of mind, incapable of knowing the nature of the act, or that is doing what is either wrong or contrary to law. It is slightly simplified from McNaughton's Rule. So here again, there should be unsoundness of mind. He should not know the nature of the act or what you're doing, whether right or wrong, he should not know. Now, 22 BNS deals with criminal responsibilities of a mentally ill person, as already I told, very, very important. Look here, what are the criteria for not to be liable? There are three criteria. Number one, there should be unsoundness of mind. Number two, should not know the nature of the act. And number three, should not know that whether it is right or wrong. These three criteria should be there for not to be liable for any criminal act done by a mentally ill person. The criminal responsibility of a mentally ill person is dealt under section 22 of BNS. McNaughton's Rule is incorporated under section 22 of BNS. A person is pleading insanity in the court of law for the crime he has committed. What protection is available in Indian law? McNaughton's Rule 22 BNS. In case of kleptomania, whether he is criminally responsible for his act, or is partially responsible for his act, or have diminished responsibility for his act, or not responsible for his act. Now, let me discuss about different mental conditions, whether he is responsible or not. If in the examination they ask whether it is kleptomania or delirium or hypnosis, whatever it is, now you should put two questions. First question, does he know what is he doing? Does he know what is he doing? Now, it may be no or yes. If the answer is no, he is not liable. At the same time, if the answer is yes, ask one more question. Does he know what is he doing is right or wrong? If the answer is no, he is not liable. And answer is yes, he is liable. Simple. For example, coming back to kleptomania, the question asks kleptomania whether he is responsible or not. Before that, I would like to tell you that in Indian law, there is no scope for partial or diminished responsibility. India believes in all or none phenomena, whether he is fully responsible or not responsible. There is nothing like partial or diminished responsibility. Now, in case of kleptomania, he knows very well what is he doing. He knows very well. Okay. At the same time, he knows very well what he is doing is wrong. In spite of that, he is doing that, maybe out of impulse. So, as per Indian law, kleptomania, he is responsible, criminally responsible for his act. Now, let me discuss on different conditions. Kleptomania, liable. Delirium, acute confusional state because of the clouding of consciousness where person does not know what is he doing. So he is not liable. Automatism, conscious performance of an act of which he is unaware, over which he does not have conscious control. So he is not liable. What about epilepsy? It is a natural disease where when you suffer from aura, then he will not be knowing what he is doing. So he is not liable. What about somnambulism? Somnambulism means sleepwalking. He will not be knowing what you are doing. But here, when the person has been diagnosed that he is suffering from somnambulism and he may become a source of danger to himself or others, he himself has to take proper care not to repeat. For example, if he is sleeping in his room has to be locked from outside. So even if he get up, he cannot come out. He should ask his wife or son or daughter or father or mother to lock from outside. Okay. So in case of somnambulism, first offense may not be liable. Subsequent offense, he is liable. Till the diagnosis is done. If it is the first time offense, he may not be liable. Later, he'll be liable. What about hypnosis? Remember very well, a person cannot be hypnotized without his consent. So before giving consent, he should know properly whether the person who is hypnotizing you is a proper person or a criminal, or whether it takes advantage of after hypnotizing you. Okay. If at all, if you give consent and if you have been hypnotized by somebody and if you ask you to do some criminal act, he is also liable, you are also liable. Hypnotizer also liable, hypnotizee also liable. Understood? Now, what about intoxication? Now, let me speak on intoxication also. Intoxication may be by alcohol or maybe by any other stupefying agent. Now, whether it is voluntary intoxication or involuntary intoxication. If a person has been intoxicated without his knowledge, then he is not liable as per section 23 of BNS. The one who intoxicated him will be liable. At the same time, in case of voluntary intoxication, tomorrow imagine I start drinking alcohol or I smoke ganja or I take cocaine, I lose my control on my mental faculties, and if I perform any criminal act, then I am 100% liable criminally as per section 24 of Bharatiya Nyaya Samhita. 23, 24. Now we know 22, 23, 24 BNS. Okay. A person is held responsible for his act done under. Here the answer is hypnosis. Best answer is hypnosis. An alcoholic patient is brought for medical examination or alleged assault of his neighbor. On examination, abnormal behavior with irrelevant talk is noted. He has history of abstaining from alcohol. Alcohol withdrawal, suffered from delirium tremens. He is not responsible under section 22 of BNS. Now, one student asked me a question. Send me a question on my Telegram group. Sir, if a person drinks excessive amount of alcohol by himself and assaults his friend, he is responsible for his act under section BNS. Yes. If after involuntary intoxication the person assaults his friend, it is not an offense under section 23 BNS. Yes. If a person having delirium tremens and he assaults his friend, it is not an offense under section 22 BNS. Yes, what she understood is perfect. What about run amok? Run amok is a condition seen in case of chronic cannabis intoxication, usually, rarely by acute cannabis intoxication, where the person suffers from delusion of persecution. He may take a dangerous weapon and go on killing the people. Once he come out from his delusion of persecution, he may feel guilt and he may commit suicide or he may surrender to police. Now, usually in chronic intoxication, he is not liable under section 22 of BNS because it is psychiatric manifestation. If at all it happens in acute intoxication, then he is liable unless it is involuntary. Liable under section 24 BNS. Okay. A chronic cannabis addict suddenly becomes violent and kills several people using a gun. He is liable for criminal act under 23 BNS, that is involuntary intoxication. Liable for his criminal act under 24, that is voluntary intoxication. Not liable under section 22 BNS. That is regarding forensic psychiatry. Okay, bye-bye.